sooner a tick is removed, the less likelihood that they can transmit the diseases that they potentially carry.
What you do when you see a tick on you is do not panic. Not every tick will transmit Lyme disease. Then things that you have around the house would be a needle nose tweezer, some rubbing alcohol, and then you should go right down next to the skin and tweeze the tick and pull it out straight. Don't squeeze the body. You may have the tick regurgitate some of that bacteria if it does have bacteria back into your skin and can transmit the disease. So you'd want to pull it straight out. And then you'd clean the area with either alcohol or soap and water if that's all you have, certainly. And then you can put the tick either in a baggie if you're going to bring it to the doctor with you, or it can be flushed down the toilet if you don't need it. You should contact your physician as soon as possible after the bite. They can evaluate your circumstances and advise you on what they want you to do next.
A tick check should start while you're outdoors. You should begin looking at your clothing multiple times per hour, checking for little black spots that could be ticks. Then before you enter a building, you're going to want to do a good brush off and make sure that any ticks that aren't attached to you yet are found and removed. Then when you get indoors, you can do a more thorough job, and you could even use a pet hair roller to try to remove any ticks that you might not be able to reach on your back. So you can use the pet roller down your leg and up your back. That's the sticky substance, and it might capture the ticks for you so that you don't end up having one attached to your skin. Additionally, you should check everyone in your family and make sure that they get into the routine if they're able themselves to look for ticks from head to toe. Making tick checks a part of your daily routine is really important, and one way that you can do that is by pairing it with a hygiene habit that you would never miss. So I like to combine it when I brush my teeth at night. Then I'm able to remember to do that tick check, and then it's done every night for sure. In case you're worried that ticks may have hitchhiked inside on your clothing, you can put them in the hot dryer on high heat for 10 minutes, and that can help to kill them. If the clothes are wet, then increase the time a little bit. It's really important to protect your pets from ticks because they can get tick-borne illnesses that humans can get as well. And they are very likely to be in tick habitats and able to bring them into your home. And so it's important to consult your veterinarian about the appropriate pet preventatives that are available on the market and vaccinations. In addition, there are collars, there's topical treatments, and insecticidal baths that you can consider. And these things should be done on a regular basis. When walking or exercising your pet outdoors, try to keep them away from grassy or wooded areas and leafy debris. Check your pet regularly for ticks, especially any trips through grassy or wooded areas. And comb through your pet's hair thoroughly, checking for any ticks that may have attached. If you find a tick, remove it promptly. Insecticides are very important for tick prevention. The two major kinds are pesticides for repelling and acaricides for killing. That can include DEET and permethrin. Permethrin is only used on clothes or shoes and should never be used on the skin. DEET can be used on the skin, but you need to follow the label directions carefully and consider washing it off at the end of the day. Also, you want to note what age it's for and talk to your doctor about these if you have any questions. So permethrin kills on contact and DEET will repel the tick. There's other categories of insecticides, and it's important that you use the Environmental Protection Agency's list when making selections. When used appropriately, we know that they create an effective barrier against you and the ticks, essentially creating a shield.
Once the tick is removed, you should watch for any fever or joint pain or muscle pain, and especially the rash that may occur anywhere from 3 days or 60 days after you've been bitten. And that should be greater than a quarter size, the size of a quarter. Generally, people will have a reaction to the tick bite itself, and that will be a smaller rash. You should contact your physician as soon as possible after the bite. They can evaluate your circumstances and advise you on what they want you to do next.
You can counter a tick anytime you go outdoors, really. They live in, they prefer brushy, moist, grassy areas where it's, mid-height vegetation, maybe, 18, 24 inches. Ticks don't fly, they don't jump, they don't hop, they don't run. Ticks can only do two things. They can crawl, and then they'll actually climb to the top of a branch, on a low shrub or a piece of grass, and they'll go to the very end and they stick out their arms and they'll just attach to something walking by. That's how they get around. You can have them in your neighborhood, you can have them in the forest, as long as, we have a lot of suitable tick habitat in our area. Ticks are going to be active, 3 seasons except for winter. Once it gets about 40 degrees or warmer, the ticks are going to come out of hibernation and they're going to be looking for a meal because they've been sleeping most of the winter and they're hungry. There are some simple tips that you can use to help reduce the risk of tick bites. Wear light-colored clothing, enclosed shoes, long-sleeve shirts and pants. Tuck in your shirt and your pants into your legs. Check your clothes and your exposed skin frequently. Try to avoid dense woods or brush. Bathe or shower after going indoors. Do a final full-body tick check at the end of the day. As a homeowner or a property owner, there's some easy ways to try to minimize the number of ticks on your property. You can make sure, for one, that you keep your lawn mowed nice and neat. Another good suggestion to prevent the ticks from coming into your manicured areas is to create borders. It's recommended maybe 3 feet wide of either bark chips or stone around your areas, and that's going to prevent the ticks from walking in that area. Another thing you can do certainly is to minimize the amount of wildlife that's coming on your property. You can fence off the perimeters to keep deer and raccoons and foxes and skunks and things out, because that's really the only way that ticks get from place to place is they hitch a ride. If you're going to store wood piles, it's a really good idea to keep them stored neatly and in sunny areas. And again, this is really in an effort to keep the rodent population down, because the ticks are going to be there because they need a food source. So the more wildlife you're going to have in close proximity to your home, the more likely there's going to be ticks coming along with it. Spraying for ticks is very effective. That should only be done by licensed pesticide applicators. And if you are going to try that yourself, make sure that you use that product, in strict accordance with the directions on the label, so that you know that you and your family are going to be safe, as well as your neighbors and your pets.
In New York State, local health departments monitor the numbers of cases of Lyme disease, or the estimated number of cases in their counties every year. We at local health departments promote our prevention messages by attending community events with civic groups, seniors, and schools. We also post educational materials on our website, social media, newspapers, radio, and television. In closing, we need to remind ourselves that ticks live among the plants and animals in our environment, and we need to know how to protect ourselves from the diseases they can potentially transmit. Throughout my medical career, I've always believed that an ounce of prevention is worth a pound of cure. If we follow the sensible measures we discussed with you today, it will go a long way to keeping us all free of the illnesses that ticks can carry. Lyme disease is caused by a bacteria called Borrelia burgdorferi, and is transmitted to humans through the bite of infected ticks known as Ixodes scapularis, black-legged tick, or the deer tick, commonly known as the deer tick. Typical symptoms include fever, headache, fatigue, muscle aches, a classic bullseye-shaped rash called the erythema migrans rash. And most cases of Lyme disease can be adequately treated by a few weeks of antibiotics, commonly known as doxycycline or amoxicillin. We can't stress enough, though, to always consult with your healthcare provider for a proper diagnosis and treatment. The ticks that cause Lyme disease may also cause other diseases as well. And again, the healthcare provider is the best person to consult with to determine if one has been infected by Lyme and another disease, and we often see these coexisting cases in some of our patients.